Okay, for the thyroid gland, it's a gland located on the trachea. It's made out of follicles, okay, and two portions connected together. And this gland is important because it produces the thyroid hormone. Thyroid hormone is important because it controls the basal metabolic rate of the body. What does this mean? It means how much energy cells are using during rest. How much energy cells are using during rest. This hormone would control that. Production of this hormone would increase energy consumption of these cells. Okay? This hormone comes in two forms, T3 and T4. And basically, we are talking about the same protein, thyroglobulin. However, we are either adding 3 iodines or 4 iodines to it. That's the T3 and T4. T3 is more potent. The cells would convert T4 to T3. As we said, this is going to control the basic metabolic rate. It will enhance the transcription of genes involved in glucose oxidation, that is breaking down glucose and producing energy. And also it's important for the protein synthesis, for fetal and childhood tissues development. And we will see when we have problems in the thyroid hormone, we will have issues with development and growth of these individuals. In case we have iodine deficiency, this is the problem coming from the diet. Okay, iodine is an ion, or iodine is something that we don't produce. We have to consume it from food. Okay, now what happens if there is low concentrations of this iodine? It means we don't have T4 and T3. And what happens is that the thyroid gland is producing the thyroglobulin, right? And this thyroglobulin, it needs the iodine. However, I don't have the iodine. Thyroglobulin will go to the cells, and the cells would be, what should I do with this? I need the T3. So you can think of it, they will send back a signal to the thyroid gland that I need the T3. The thyroid gland will think maybe there is a huge demand, so it will start to increase the production of the thyroglobulin. But the problem is not here. The problem is with the iodine. Okay? At one point, there is always a demand for the T3, and the thyroid gland will think, okay, I will add more cells in order to enhance the production of the thyroglobulin. This will develop something called a gutter, enlargement of the thyroid gland. Enlargement of the thyroid gland to keep up with the need for the thyroid hormone. But again, the problem is not the thyroglobulin, the problem is the iodine. That's why they started to add iodine to salt to prevent these issues. Pregnant women, when they have iodine deficiency, this will affect their babies and their pregnancy. So sometimes we will have even infant death due to iodine deficiency during pregnancy. This also will decrease fertility. It will cause impeded growth and development. It will affect the nervous system. Mainly, it will affect the nervous system. This is one of the major causes of mental diseases. This is one of the major reasons to have mental disabilities around the world. Also, this, in case the baby is born, usually they will have something called the neonatal hypothyroidism, in which they will have conjunctive defects, short stature, deafness, muteness. All of these problems, they will not be able to develop, to grow, because of that iodine deficiency before they were born. In case we have hypothyroidism, low secretion of the thyroid hormone, it means we are going to have low metabolic rate, we are going to have weight gain, cold extremities, reduced libido, menstrual irregularities, reduced mental activities, okay, because of the hypothyroidism. Remember, this hormone is going to increase the metabolic rate. In case we don't have that hormone, it means we are going to have metabolic rate. That's why we will have cold extremities, because there is no production of heat. Weight loss, there is weight gain, there is no burning for glucose or fat. The opposite is when we have hyperthyroidism. Here we will have something called the Graves' disease, and almost will give us the opposite effects. We will have high metabolic rate, excessive body heat, sweating, diarrhea, weight loss, tremors, and increased heart rate. Okay, here the cells are consuming energy at higher levels than normal. One mark of this Graves' disease is the bulge of the eyeball. Okay, this is a unique mark of this disease, and sometimes these people will develop also a goiter. Another hormone produced from the thyroid gland is the calcitonin. Calcitonin is important in regulating calcium levels. We have seen it in AB1. What does it do? It will inhibit the activity of osteoclasts. These are the cells that break bone. It will enhance the activity of the osteoblasts. These are the cells that will form bone. It will decrease calcium absorption from the kidneys and from the intestine. Now, calcitonin is not really a big hormone in calcium homeostasis. People with thyroid cancer, their thyroid gland would be removed. They would receive thyroid hormone supplements, but very rarely that they will receive calcitonin. Parathyroid glands are small glands, 4 to 8 small glands at the back of the thyroid. These are important in calcium regulations. They produce a hormone called the parathyroid hormone. This is the main hormone that regulates low calcium levels. So this would be released in case we have low calcium level, and it will cause increased calcium levels. How does it do so? By enhancing the osteoclast activities. These again, the cells that will break down the bone, inhibit the osteoblast activities. It will cause increased reabsorption of calcium from the kidney. It will activate vitamin D3, and vitamin D3 is extremely important for absorbing calcium from the intestine. All of this are things we talked about in AB1. Now, in case we have hyperparathyroidism, high secretion of the PTH, it means we will have excessive calcium reabsorption from bones. This means that we might develop loss of bone density, which makes the bone fragile and not capable of holding the body weight. However, this is not the only problem. The other problem would be, it means that I will have high calcium levels outside the cells, and some of this calcium might escape inside, which will disturb the membrane potential, would decrease the absorption or the tendency for sodium to be absorbed. This would affect the action potentials. If you remember, action potential was about the rush of these sodium ions. So here, and mainly in the nervous system, we will have less responsiveness. We will have reduced responsiveness of the nervous system. The opposite will happen when we have low secretion of the parathyroid hormone. So here we will have extreme low calcium levels, and again this will affect the membrane permeability to sodium. It will result in muscle twitch. It will enhance it actually. It will enhance and it will cause muscle twitch, cramping, spasms, and convulsions. Sometimes this hypoparathyroidism is extremely dangerous because it affects muscles involved in breathing. Okay, so sometimes it will paralyze these muscles, and this could be fatal. So that's it for these two glands. Let me know if you have any questions.